ดีค่ะ
สวัสดีค่ะ Welcome to Good Morning with Thai PBS World. I'm Nad Bunag.
And I'm Hatay Teshakit Hiranan, and kicking off the program with the latest on the COVID-19 situation. Just yesterday, the Prime Minister said he is seeing signs that the COVID-19 spread in Thailand is slowing. And this is despite the fact that there was a record daily death toll high yesterday of 312, and that the figures remain over 20,000 each day recently. Prime Minister Prayut Chan-o-cha also said that the pandemic in Thailand may reach its peak soon if the current lockdown measures are strictly observed, with infections hopefully decreasing next month. The Prime Minister said that the daily new recoveries have been exceeding the new infections recently, which is actually a good sign. However, he is concerned still about the high number of deaths, saying that nobody wants to see another. And as I mentioned, we have a new record daily death toll high of 312 yesterday, which is a big leap from the previous high of 239 on Monday. But according to the CCSA Kunat, this is because some provinces were slow in confirming and reporting deaths, so they have been added just now. Kun Prayut also cited the Public Health Ministry's claim that if the lockdown efficacy is increased, it will help reduce the number of new cases and deaths. He also asked for everyone's cooperation just to help reduce the number of new infections and deaths, where he is promoting the concept of universal prevention. And this includes, for example, going outside only when necessary, keeping 1 to 2 meters distance from others everywhere, wearing face masks at all times, both outdoors and indoors, washing your hands frequently and avoiding touching your face mask, and of course, disinfecting frequently touched surfaces.
Exactly. And meanwhile, speaking of the Prime Minister, he actually had a phone call with the Australian Prime Minister Scott Morrison yesterday to discuss bilateral relations. And in the meantime, he did ask for Australia's assistance in the supply of COVID-19 vaccines. And the Australian Prime Minister said yes, but pending details are to be worked out soon. Apart from the vaccines, other issues discussed were climate change, digital transformation, the post-COVID-19 situation, and the new normal travel. Australia has also affirmed its commitment to further strengthening of relations with Thailand through the strategic partnership and the development of ASEAN-Australia relations as well.
Well, in terms of bilateral relations, Kunad, it is always good to have good friends who are also resourceful. And speaking of the pandemic, though, we'll just have to always remain vigilant and careful so the number of new infections can really slow, as the Prime Minister and all of us also hope.
Exactly, Hunatai, and the universal prevention concept here, it's all common sense to be very honest, but some people seem to forget about it with the basic things such as wearing face masks, keeping distance. So that is why it has been reinforced again to curb the spread of COVID-19.
Exactly. And speaking of Australia, we hope you enjoyed our first episode of The Ambassador with the lovely Swiss ambassador yesterday. So next week, though, do stay tuned for our exclusive interview with the Australian ambassador as part of our efforts to bring to life the life of diplomats here in Thailand and to answer most of the burning questions.
Well, I'm definitely really excited for this interview. And now let's talk about the issue with COVID-19 vaccines. We have to admit that the vaccine rollout is still very slow, with only a very small percentage of the entire population being fully vaccinated. And in light of this, Thammasat University is ready to procure additional COVID-19 vaccines from abroad to give members of the public and private sectors and public organizations more options. The director of Thammasat University Hospital said that the university's council has decided to invoke regulations pertaining to the provision of medical and health services by the university to procure vaccines and related medication. This will make Thammasat University the 6th agency legally permitted to procure COVID-19 vaccines, in addition to the Disease Control Department, the Government Pharmaceutical Organization, the Thai Red Cross Society, the Julapon Royal Academy, and the National Vaccine Institute. And the university plans to import second-generation mRNA and protein subunit vaccines from Novavax and Johnson & Johnson, which are expected to arrive next year.
And speaking of the mRNA vaccine, Thailand's Department of Health has recommended that people aged from 12 to 18 who are suffering from any of the 7 underlying diseases, including obesity, chronic kidney disease, stroke, coronary artery disease, chronic respiratory disease, diabetes, cancer, and genetic disorders, and for these people to get inoculated with Pfizer due to the steady rise in COVID infections among this teenage group. The department's Director General also suggested parents contact hospitals which are offering vaccination services for this age group before going for a vaccination.
So there is definitely a good reason why vaccination is so important within this age group, especially with the mRNA vaccines, as over 16,000 children in this age group have already been affected this month, and the infection rate is very likely to increase as well.
So there's actually a new group to be prioritized, the teenage group, for example. We're still getting 30 million more doses of Pfizer plus 1 million more from the U.S. government. So hopefully more people will soon be able to access the mRNA vaccines.
Definitely.
And moving on now to politics. Today is the second day of the 3-day annual budget parliamentary debate, where the opposition is working hard to try to cut a big chunk of proposed government spending. The opposition parties are seeking to slash the government's 3.1 trillion baht proposed spending in the 2012 fiscal year by 100 and 300 billion baht in the bill's second and final readings in the parliament. For example, Pheu Thai MP for Bangkok, Kun Jirayu Huangsap, said the opposition is seeking to trim the spending budget by 10%, or about 310 billion baht, which is actually quite a big chunk, to reduce the budget deficit. He claimed that many expenses, such as defense procurement of weaponry and various seminars, are a complete waste under the present circumstances. He also said he didn't have much hope that the government would prepare a sensible budget, citing the limited budget for the healthcare during the surge in COVID-19 infections.
At the same time, Move Forward Party leader Pita Limjaroenrat said that the 16.3 billion baht trimmed from the budget by the House Scrutiny Committee is insignificant because he believes that more cuts can be made in defense spending, investment in the construction of new provincial offices, and various other overpriced projects. And his fellow Move Forward Party MP Sirikanya Tansukun said there is more fat that still can be shed, and she suggested a revamp of the budget structure. She also pointed out that 40% of the spending is salaries for government officials, and the budget increases every year, while it is doubtful that the government will achieve its revenue target for the next few years. Sirikanya also said the budget should be structured to address the crises currently facing Thailand.
And for another opposition party, Prasha Chat, there's an MP, Kun Tweet Satsong, who proposed a 10% cut in the 8.9 billion baht central fund, as only 2.7% or 2.7 billion baht of this year's fund has actually been spent. He noted that the spending of this central fund is difficult for opposition MPs to check, and also because it's also not transparent. He said most of the central fund allocated in fiscal year since 2018 was spent on military procurement instead of being spent on the well-being of the people. So the government's proposed annual budget is actually slightly lower than last year's, which was at 3.28 trillion baht. But of course, with the pandemic worsening, the focus of the debate will be on something like military spending and the central fund, where the spending itself is being questioned when Thailand is actually being in one of the worst crises ever.
Exactly, but we still have 2 more days for the budget bill debate, so it's today and tomorrow. So we'll have to see whether the opposition's demand will be successful.
Exactly.
And now let's have a look at the other stories you need to know for today. We'll begin with this story. A 70-year-old woman in Thailand's northeastern province of Buriram was mistakenly given 2 shots of AstraZeneca vaccine on the same day at a vaccination center in the province. Fortunately, she has not yet developed any serious side effects. Her son immediately informed provincial health officials when he learned about the mistake, saying that he will not file a complaint, but he would prefer officials to be more cautious and to not repeat the same mistake again.
Yes, exactly. So this is something quite dangerous because we entering the unknown territory as well. And some good news for a lot of people that still haven't received the second vaccine dose. The Public Health Ministry has opened registration for the second COVID-19 jab, where people can choose to be inoculated at the nearest hospital. And this is to help add convenience so people from other provinces don't really need to travel into Bangkok only for the vaccination, but they must show their vaccination appointment to get the chosen hospital 2 weeks before they get the shots.
Meanwhile, it has been reported that anti-government protest leader Parit Chiwarak, or Penguin, who's infected with COVID-19, is classified as a light yellow patient, or a patient with moderate symptoms due to his obesity and other underlying symptoms. 3 other infected inmates are classified as green patients, or those with mild symptoms or asymptomatic.
So we can see that actually his condition is not very serious, not in the red zone yet.
Right.
But it has to also be noted that infections within the prisons is still ongoing, despite being actually much less now. But the pandemic still going on within the prisons itself.
Exactly.
And moving on to another segment of our program, and every Thursday, like today, we explore the lives of expats in Thailand on home away. So this week, we introducing you to an American businessman and a founder of the Bangkok Community Health Foundation, Great Lunch, who has become a familiar face among the members of the Watana and Klong Toi communities. His restaurant, Sunrise Tacos, now prepares 3,000 hot meals a day for the people in need. And Greg's mission is to help grassroots people to survive the deadly COVID-19 outbreak.
Last year, Greg and his partners started a charity for the have-nots in Bangkok's Klong Toi community during the first wave of COVID-19. When it ended in May, they continued working for the neighborhood by cleaning, renovating, and construction projects to improve people's living conditions.
You know, when you go through the community and people recognize you and you get the big smiles and you see the rewards, right? It's a big moving part when you go through a park that you know that used to be a garbage dump that 300 kids walked by when they went home from school, and you know there'll be rats eating the garbage, and there was a open sewer, and now they go into a beautiful park that they can play in, and you know they play with the paper planes and you know catching butterflies and all that. It's beautiful. And versus a garbage dump that was the most terrible thing you ever want to see, a lot of disease, right? So when it was in your brain to do something like this, and then you see that, wow, it's fantastic. You can make all the money in the world, but I don't think it equals that moment that you see that.
With the recent wave of COVID-19, his foundation focuses mainly on Watana and Klong Toi districts. as there are a large number of desperate and impoverished residents. Most of them are struggling during the lockdown. Usually, his team prepares 2,500 to 3,000 hot meals a day and give out up to 600 relief bags. The demand for food and care packages varies depending on to which community they are going.
Today would not be a very exciting day as far as the spend, but it would probably be about 80,000 baht we'll spend today. But we can get up to over 300,000 baht in a day that we spend.
Charity?
We're very blessed to have donors, not just big donors, but also very small donors that will send 19 baht or 20 baht or 50 baht or 100 baht. And so we get donations from many, many Thai people, along with expats and people around the world, as well as big corporations.
Currently, there are 375 volunteers at the Bangkok Community Health Foundation, both Thais and expats. Every day, they help to pack care bags and prepare hot meals. These volunteers do not want anything in return. They just want to give back to the community.
You know, it's just like donations where it feeds upon itself, it becomes a snowball. People hear about you, they see that you're doing good things. It's the same way with people that want to give their time. It feeds upon itself because one of their friends is doing it, or they heard and they saw other people do. And then when they join, it has to be a positive energy. If there's no positive energy, if everybody's negative, then it'd be short-lived. People would just drop out. But it's extremely rewarding for the volunteers. They get uplifted every day by seeing what was happening. They see people donating, and it feeds upon itself as far as the positive momentum, because we definitely need positive momentum of what's going on with COVID right now.
To reduce the risk for other volunteers, Greg and his co-founder, Friso, normally go out to give away care packages at the communities, sometimes not wearing full protection, just 2 layers of face mask. In the next part, we'll discover the reason behind Greg's dedication and his view on what went wrong with the way we are handling the third wave of COVID-19.
So it's really nice to see that Greg has contributed so much to the communities, as there are many poor families that have been affected by the pandemic.
And of course, Greg is not the only one, as actually there are a lot of expats here in Thailand that have become the part of their own communities and helping out people in need within their areas and neighborhood as well.
Exactly.
So this is actually quite a really good thing, and also a positive thing to think about and brighten your day. And with that, we wrap up this edition of Good Morning with Thai PBS World. Even though we changed our program timing, we're still updating you with all the latest stories on our website, www.thaipbsworld.com, and our social media. So be sure to follow us and retweet.
And don't forget to catch our morning show every weekdays at 7:30 a.m. only on Thai PBS. Thanks for watching, stay safe, and we'll see you tomorrow. สวัสดีค่ะ
สวัสดีค่ะ